All right, so for my week four video journal, I was given for my report analysis vocational rehabilitation. Here is my PowerPoint. So basically, what vocational rehabilitation is it's when somebody suffers from psychological, developmental, cognitive disorder or suffers from a severe illness, and this illness or disorder takes them away from working their job. Often, when they're taken away from working their job, the person is feeling hopeless, weak. They often suffer from money issues, and that also helps create stress. So this is basically a form of rehab that gets the person back to working individually and being more independent. A description of the required document reports. So basically, these reports are for a vocational rehabilitation specialist. These are given to get a better understanding of the patient's disability. It not only helps the doctor or specialist to get a better understanding of the disability, but it also gives the patients a better understanding. Sometimes patients aren't fully understanding of what illness or disorder that they may be suffering and what's fully taking them away from doing their independent things that they like to do and or work. These reports also help to set goals. They help to monitor daily activities, and they also cover basic health information of the patient. So on the next slide, there's examples of vocational rehabilitation. One thing that's really big in vocational rehabilitation is goals. Obviously, if somebody is taken away from work and they are suffering from potentially maybe suffering from depression or anxiety or money stress or other things that they may be stressed about, goal setting is a huge thing. Often, vocational rehabilitation specialists will set goals for the patient to want to try them to get them back to work and doing their work life and living independently. Rehabilitation is obviously a big thing if they are suffering from a physical or even mental issue. Job analysis, like how the patient can get back to work and maybe um, making their job a little different, how they can adapt to it. On the next slide, description of the required information in the reports. So, first, there's usually an assessment form, and there's also a report form. Both are given at the end of my Blackboard slide. Um, Basically, the report form shows goals for the patient. It also shows daily activities that the patient does. It gives a deep description of their disability or illness. It gives timelines of when they think the patient may be able to go back to work or when the patient may be able to be living independently. Other information included is often um, basic information like name, date, year, birth date, payment info, insurance, and race, ethnicity, and obviously their work, what they do at their job, what their role is in the company. On the next slide, this is basically an example of some questions that a specialist may ask a patient. Some of the questions are, what do you do in a day-to-day basis? What do you do at your job? What is your role in your job? What does your disability or illness hinder you from you doing? What's hard for you to do independently? A lot of the other things that this table shows is how can you set goals? What is your main goal? What's your first step goal? What's a long-term goal? Um, this table I felt also was very important because it helps create a relationship with the patient. It helps get a better understanding of the patient's view on their disability or illness, which I thought was very great for a specialist. Why this information is important. Like I just said, it helps create a relationship with the patient and to be able to truly understand what they're suffering from and what they're being hindered from in their life. It provides good information. Obviously, if the patient is visiting other specialists, it helps give a better, deep description of what the patient suffers from. It helps other doctors to get a better understanding of what the patient is suffering from. It keeps everybody on the same page. It gives proof of identity, who the person is, what past medical history that they've had. background information, and also the reports also show growth and improvement. So it'll show what the patient started off as and how they've improved, and their mobility, how that's improved, their speech, how that's improved, and obviously the end goal is to get back to living independently. On the next slide, how the reports are utilized. I kind of already stated they're utilized for the patient to get a better understanding of their disability and how they think, how their status of the patient will be laid out, how long they're estimated to get back to work, what they have to do to work towards something to get back to living independently and to be able to do things that they may have hindered them before. It also helps to get background information on the patient and to keep everything on the same page. On the next slide is the example samples of the reports. So for my first example, number 1, I have an assessment report. Basically what that is the first initial meeting with the patient and getting a better understanding of the patient's disability. It also helps get insurance, background information, past medical history, maybe other surgeries that they've had, um, other specialists that they work with, and what they do for that. The report form is obviously the rehab, what they're doing for their rehab, what goals they have, what they do in daily activities, what they do with their specialist. It kind of keeps tab of everything and keeps the goal in front of them. And those are my references. Thank you.